at night
Okay.
and associated with noisy breathing.
Hmm.
No, I mentioned earlier, these are majorly caused by viral infection. No use of antibiotics, but sometimes to use other supportive medication.
Okay.
Other
Okay.
causes of cough include acid reflux, and when you usually have a patient come with coughing as part of the symptoms, then you may also complain of frequent vomiting, that
Okay.
the child is also vomiting or they may be spitting up frequently.
Okay. Okay.
Other cause of cough in children may be due to allergy, you know, allergy or sinusitis,
Hmm.
infection of the sinus, or allergy of the respiratory tract. Usually cause maybe also another cause of coughing
Okay.
in children. Uh, we also have whooping cough, in which the child, have the cough comes in bouts, and after the cough, after the end of cough, there is this whoop sound that comes from inside the chest, and this one is caused, by also common in children.
Okay.
Um, thing that a child cough is when you have um, a foreign body inhalation,
Hmm.
in which the child may not necessarily have to be sick. And when you inhale foreign body, they may need to, I mean, to bring it out.
Okay.
And this may cause cough. And also environmental influence, which may not really be due to cause an underlying, due to environmental, such as gas, pollution from cigarettes, or smoking, or from fireplace, also cause coughing in children. And uh, just as I mentioned earlier, coughing may not necessarily have to be due to diseases. It may be due to normal clearing of airways. When you have irritants,
Yes.
the normal thing is that your body wants to clear, these irritants, and this uh, may cause cough.
Okay.
And especially if you have uh, improperly swallowed fluids,
Hmm.
food or liquid, which irritates the airway, may also cause cough.
Okay.
Those since these are the common causes of cough
Okay.
uh, in children.
Thank you very much, Dr. Akinola. Now, my question is for parents, because as you stated now, in detail, there's so many causes of cough. So would you say that because it's so many, so as a parent, it should be good not to just assume that this is exactly the kind of cough my child has, and so the next thing I do is just to go to the over the counter, get over the counter medication or drug and just give the child. Would you say that once your child develops a cough, they should go to the hospital, or should they just go ahead and just get the next cough syrup and give it to the child? Because, like you say, there's so many reasons why a child might have a cough.
Um, I will not advise over-the-counter
Mm,
medication,
yes.
drugs for cough. Uh, Medicine, and even pediatrician,
Mm,
I will not advise use of over-the-counter medicine for a child under the age of 2 to 5 years.
hmm.
Maybe older children, which can express themselves, may be able to at least be able to manage if it's not a serious cough.
Yes. Hello, doctor.
After
Yes.
5 years, it is
Yes.
not advisable
Hmm. But
because some of
yes.
these drugs,
Mm.
also contain some other medication which uh, will I say other active substances which may worsen the condition of the child.
Mm.
Some of them it make them drowsy.
Yes.
Some of them it also you know they use with other which uh, potentiates their effects
Okay.
and they worsen the condition. Some of them just as if it's delaying your visits to the doctor, may
Hmm.
not really work.
Yes.
For example, due to bacterial infection, cough that is caused by pneumonia, maybe it's due to pneumonia,
Hmm.
and over the cough, over the cancer medicine may not work,
Hmm.
you know. So, and for that type of cough, you need to go to see your doctor that
Yes.
will make proper diagnosis and give you the necessary antibiotics
Hmm.
that will treat. So it is advisable by the time you are having cough, 2, 3 days, 5 days, and especially when there is cough associated with other symptoms
Yes.
like fever, high fever, or you are having difficulty with breathing along with the cough. It's not a cough that you just keep the child at home.
Hmm.
You may have to go and visit your doctor so that the doctor will examine the child, make a proper diagnosis, and give appropriate treatment to the child.
Well, thank you so much for clarifying that because a lot of parents actually, once the child develops a cough, they feel a cough is just a very minor ailment. Really just go to the pharmacy and just get cough syrup or maybe vitamin C or what have you, and just treat the child, thinking that cough is just a normal, very, very common ailment. So thank you so much for clarifying that, so parents can know that you don't, even if it's just an ordinary cough in coat, you shouldn't just go ahead and just go to the pharmacy and just buy whatever you think would help the child. Ensure you see a doctor for that. Thank you very much for clarifying that. Now, moving on to cough and more information on cough and more questions on cough in children. I really like to know about the differences between maybe like a cough caused by maybe a viral infection or a bacterial infection. Can you please elaborate more on that? How do we know if it's a cough caused by bacterial infection or it was caused by viral infection? How do we know the difference? Hello, doctor. Hello. Hello, Dr. Akinla. Are you still there? Okay. We seem to have lost connection there, but very, very soon we'll be able to get back with Dr. Akinola. Remember, this is Radio Doctor on WFM 91.7. Radio Doctor on WFM 91.7. It is about 18 minutes past 10. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized radio health program on women radio, broadcast from 10 to 11 a.m. Monday through Fridays. Hello, Dr. Akiola, you still there? Hello? Hello, Dr. Akiola? Okay. Yes, we're still talking about cough in children. You can definitely send in your questions if you want to contribute to the topic we're talking about right now. Or you want to ask a question. Please go ahead and send in your questions to 070 317 56537. 56537, or you can call in. You can, phone lines are open now. Call in on 07000 917 917, 07000 917 917, or 090 256 254 55. Hello, doctor. Hello, doctor. Okay, we're trying to reconnect with Dr. Akinola there. Yes. You can also join in the conversation by sending in your contribution to our social media platforms: Facebook, Instagram, Twitter, and YouTube at WFM917, or you can log on to our website, www.com, to listen to M917 live from any part of the world.
Radio Doctor and WFM 91.7 every Monday from 10 to 11 a.m. brings you medical experts specialized in children's health.
Studies have shown that children that were abruptly stopped from breastfeeding tend to have some emotional trauma.
Call in to get free consultation on children's health on 07000 917 917 or 090 256 25455. You can send in questions, cases, and related contributions on social media: Facebook, Twitter, and Instagram at WFM 917. Text and WhatsApp on 070 317 56537. You can listen live online at www.wfm917.com. Radio Doctor, Nigeria's first free consultation radio health program on WFM 91.7, the voice of women.
Yes, we're back on again on Radio Doctor and WFM. Hello, Dr. Akinola. Hello? Hello? Hello, Dr. Akinola. Can you hear me now?
Hello?
Okay, can you hear me now, ma'am? Hello?
Hello?
Can you hear me? All right, as we still try to connect with Dr. Akinola there, we're still talking about cough in children, cough in children. And one of the things that she mentioned, that Dr. Akinola mentioned, by the way, Dr. Akinola is a consultant pediatrician with St. Ives Hospital, St. Ives Family Hospital. And one of the things that she talked about was that when your child develops a cough, don't just assume that it's just like a common cough, because as parents, we normally just say, oh, just a common cough. I could just buy cough syrup or maybe vitamin C or what have you, or antibiotics, and just give it to the child, thinking I just think it's just going a few days. You heard her. She said there's so many causes of cough. So do not just treat your child by yourself. Go to a qualified medical professional so that they can diagnose what exactly is wrong with the child. Hello, Dr. Kela, are you back on?
Yes.
Yes, thank you for getting back on the program with us. Yes, so let's move on. When it comes to a newborn baby, a baby that was just born, is it possible for the baby to have a cough? Is it possible? Can the baby have a cough, a very newborn?
Hello?
Can you hear me?
Yes.
I said,
I can hear you.
yeah, I said a newborn baby. Can a newborn baby, a baby that was just born possibly today, maybe like a 2-day-old baby, is it possible for the child to have a cough?
Yes, it's possible for a 2-day-old to have a cough.
Mm,
I mentioned earlier that it's not necessary that you don't necessarily have disease when
mm,
you are coughing.
yes.
Cough can be as a result of clearing irritants
Mm,
from the airway.
yes.
Maybe you have irritants, environmental irritants like gas, cigarette smoke, or even when when you are eating or you are taking fluids and it went to inappropriate way, you want to clear it. So a newborn also have that reflex, have what you call that cough reflex.
Mm,
That's when there's irritant or when it's sucking breast,
yes.
rather than going to the esophagus, it went into the airway.
Mm,
One of the ways to clear it is to cough.
mm,
A newborn can also cough. A cough may not necessarily have to be a disease type of cough,
okay.
but yes, newborn uh, can also cough. I'm
Okay.
answering your question.
Okay, thank you very much. Thank you very much. I'm still speaking to Dr. Akiola, a consultant pediatrician from St. Ives Family Hospital. We're still talking about cough in children. When a child coughs, can coughing damage a child's lung or chest? Sometimes you can have a child that they cough so the cough is so severe. They will be coughing almost every minute. And sometimes you wonder if it could damage the child's lung or chest. Is it possible for a cough to damage a child's lung and chest?
Yes, it's possible. When you have severe cough,
Hmm.
uh, it sort of can rupture lungs,
Hmm.
releasing air in the lungs, can have hematocele, can have several some complications due to when you have severe, not mild. When you have severe, whooping cough, you
Mm.
know, earlier, it comes in bouts and may be severe enough to cause rupture, of
Hmm.
from the lung into the pleural,
Hmm.
and also can also have rupture of vessels of the eye, having subconjunctival. So there are some complications that comes with months or moderate.
Okay.
Severe cough also can have some complication.
Okay. Thank you very much. Now, if a child does not sleep well because of coughing, severe coughing, what should the parents do? Maybe they're unable to get to the hospital immediately. Maybe it's the middle of the night, or maybe they're far away from the hospital. What should the parents do at that point in time? If a child does not sleep well because of coughing, what should parents do?
There are some old remedies that can be used at home,
Okay.
for cough, provided something is caused by that is not severe enough.
Okay.
Or we can use with fire, cool mist in the fire,
Sorry,
especially
I didn't hear that, doctor.
cough that
You said what's ma? What did you say?
especially cough that can are caused by irritants.
Okay.
Those ones easily, you can take care of that
All
at
right.
home.
Okay.
Remove the irritants.
Okay.
It's causing the cough.
Hmm.
I mentioned earlier that some irritants affect the throat, and cause cough. Even dry hair or extreme hot hair can also cause cough.
Okay.
Change in weather condition can cause cough
Okay.
in children.
Mm.
You know, even change in barometric pressure can cause cough, because all these ones will serve as irritants to the throat, and the normal reflex is for the patient to cough it out.
Mm.
So most of these cough that are caused by irritants can be managed, with if you have humidifier, it moisturizes the air and makes the breathing easier,
Mm.
like decreasing the nasal passage.
Okay.
Use of saline drop or spray. Hello?
Saline drops or spray?
Saline, yeah,
Okay.
or spray.
Okay.
For irritants, for cough that are caused by irritants, you can use it in the nose.
How do we know if the cough is caused by irritants?
That is where the problem is.
Okay.
Most patients, you may not be able to know.
Mm.
If someone that have experience, probably those that have used before,
Okay.
and you'll be having repeated cough, and you have discussed with your doctor, and he has managed situation for you at once. Sometimes when you're having the same experience, you may be able to know.
Okay.
But it is advisable, if you are coughing 1 or 2, 3 days and there's no improvement, it's better to see your doctor, because you may not be able to distinguish this type of cough yourself. Sometimes even doctor, before they make diagnosis, they may need to examine, and sometimes even go further to do some tests to be able to clarify this type of cough. So that's why it's not advisable for you to just sit at home when you are coughing for a long time and you don't have improvement, because there are several causes, and these causes, they have different ways of managing them. But cough that are caused by irritants, they are the one that can easily manage, at home. There are some that just need some simple take care of that.
Okay. Like, and saline drops, can those be readily pharmaceutical stores?
Yes, they can be get humidifier, and saline drops, pharmacy store.
Okay.
Small children, newborns, if it's due to irritant, you can use nasal suction. Those ones are easily, you can get at pharmacy.
Could you suggest any other home remedies that parents could use for a child that is coughing? Because sometimes I hear about palm oil and sugar. If you just help us to tell us the ones that are appropriate or not. I've heard about palm oil and sugar. I've heard about honey and lime. I've heard about ginger. So could you please let us know which of this is this a children if they're coughing?
I don't know about palm oil and ginger.
Sugar. Yes.
Sugar,
yes.
Never used it before. So I don't. What I don't.
Yes.
I recommend. But I know honey helps.
Honey
The
helps.
only problem is that it is not advisable to use honey in children under 2 years. Because it contains an organism which may be harmful of botulinum, which may, be harmful to them, because that gastrointestinal develop.
Mm.
So it is advisable for children under 2 years not to use honey as home remedy.
Mm.
But what cough, not all times,
Okay.
especially if they are irritated, all those cough that are caused by irritants, it can help to soften the cough and older children.
Okay. Okay. The program you're listening to is Radio Doctor on WFM 91.7. Radio Doctor on WFM 91.7. Radio Doctor is a program where you get to listen to real doctors advising people like you and me on different ailments and different issues when it concerns your health. Radio Doctor is Nigeria's first specialized radio health program on Women Radio, WFM 91.7. It's about 25 minutes to 11. And I've been speaking to Dr. Olufunlola Akinola, a consultant pediatrician at St. Ives Family Hospital. We've been talking about cough in children. Now, doctor, there could be some children that might be asthmatic and the parents might not actually asthmatic. How do parents know if the cough a child is having is related to asthma?
Asthma, there are some other cough, symptoms that comes with cough, in an asthmatic patient.
Okay.
It comes with cough, there is cough, and this cough mostly is worse at night. It comes with difficulty with breathing. They may not necessarily have. Then they may also come with chest pain. For a child that can talk, that can, tell you how he's feeling, they'll be able to tell you that there is having chest tightness, chest pain.
Yes.
So by the time you're having prolonged cough and this child is having problem with breathing, you don't need to wait. It's better you take this child to see his or her doctor.
Yes.
And by the time the doctor examines the child, he will be able to make diagnosis that if it's due to asthma or not.
Okay.
Or sometimes you may also have this child having wheezing, a noisy breathing that comes, a musical noisy breathing that comes from inside of the chest,
Okay.
So when you have all these other symptoms, we have to be suspecting that it's asthma.
Okay.
But take the child and make proper diagnosis.
Yes.
We need to do some other tests if necessary, but mostly do physical examination and history taking to make the diagnosis of asthma.
Okay. Thank you very much. One common theme that Dr. Akinola has been saying that I've noticed is that she's saying that you need to ensure that you see a doctor. Don't just assume child has is just a common cough associated with a common cold. Ensure that you see a medical doctor for proper diagnosis. You can call in. The phone lines are open. You can call in on 07000 917 917, 07000 917 917, or 090 256 25455. 090-256-25455. Call in. You have a question for Dr. Akinola on this topic, or if you have questions about your health, please by all means call in on 07000 917 917 or 090-256-25455, or send a text or WhatsApp message to 070. Have a call coming in. Yes. Hello? Hello? Okay, we lost that call. Yes. Hello?
Hello?
Yes, hello. Good morning. Hello, good
Hello.
morning. Good morning. What's your name, please? Where are you calling from?
Good
everybody. I'm Chinedan calling from Madrid.
Nice to hear from you. Please go ahead.
Okay, actually, I'm going to ask a question for something different from what
Say it again.
I want to ask questions for something different from what I have gotten.
Okay, go ahead, please.
Okay, I just all of you just notice that my baby is only temperature is hurting back. I don't know what remedy I could do.
What's wrong with your breathing? Is what? Your breathing is what?
It's hurting all his body.
It's hurting you. Okay. All right. Okay. Dr. Akiola.
Yes.
Yes, the listener that just called in said that is an adult. He said he noticed that when he breathes, it always hurts him when he breathes. That is his question.
Okay. Is the apart from breathing, is there any other? Does he feel tired easily? Is he coughing? One of the causes of, when you're having breathing and that is hurting. I'm not. First, apart from, you may need to ask some other questions.
Okay.
Along and during the examination, asthma, and may also be due what you call pleural lining infection.
Okay. Okay.
There is infection of the pleural lining.
Okay.
That's
Okay.
when it's bleeding and it causes hurting.
Okay.
So I advise him not to just sit down at home. Maybe go to hospital.
Yes.
And see a doctor that will examine, ask questions from him, that is history, and if there is need, they may also need other investigation.
Okay. All right.
Especially adults,
Okay.
advise them to just sit at home, maybe more than that.
Okay. Thank you very much. Thank you very much for that response. You can also call in to ask your own question. You can go ahead and call the number 07000 917 917, 07000 917 917, or 090 256 25455, 090 256 2455, or send a text or WhatsApp message to 070 317 56537. This is Radio Doctor on WFM 91.7, and we're still talking about cough in children. Please call in if you have questions, or you can also send a text or WhatsApp message. We'd like to hear from you. Moving along, Dr. Akiola, about cough. What are the treatments available for cough?
There are several treatments depending on the cause.
Okay.
So, starting from the use of cough medicine, antibiotics, there may even be need for antiviral drugs. So, treatment depends on the type.
Okay. Okay.
And I also mentioned earlier, for irritant cough, there may be need, to use some of these humidifier, the nasal spray. Also, allergies. There is need to use anti-allergic drugs.
Okay.
For asthma has its own treatment. And the cause. So specific treatment for cough, you treat on the cause.
Okay.
Even avoidance measure is even enough to treat cough. Maybe if it's due to irritant, avoid what caused the irritant, and the cough will go away. And there are some even causes that may not even need treatment. It will go on its own.
Okay. Okay. All right. Are there any things that parents need to pay attention to, especially during cold weather, so that wouldn't develop cough, or it doesn't really matter per se?
Sometimes you may not really have a total control over a child developing cough or not. Because I mentioned earlier, sudden change in weather, sudden change in temperature affects the environment and may cause irritants on the throat and leading to a child developing cough. And since you don't know when weather will change.
Hello, doctor? Hello? Hello? Hello?
Hello?
Yes, I can hear you now. Please go ahead.
So, as a mother, you may not really have total control. But if it's due to allergy or due to irritant, as much as possible, some of these things you need to avoid. It's not good for child to be exposed to tobacco smoke.
Okay.
So if you are, please avoid smoking where there's children. Either active or passive smoking is one of the causes of cough in children.
Okay.
So please avoid smoking and exposure of your child
to smoking. Okay.
And this is one of the things that you can have total control. Or exposure to firewood smoke.
Okay. Okay. Firewood smoke.
Yes. It can also serve as irritant. It can cause cough in children.
Okay. Okay. Thank you very much. I usually hear this a lot, that you shouldn't give your children cold water because it causes cough or can cause a cold. What would you say I have to say about that now? Is it true or false?
What I'll say about cold water, use of cold water in children, I mentioned earlier that extreme change in temperature, either too much dryness or too much cold, serve as irritants on the throat. So if you're exposed to cold water to some children, it may serve as irritants in their throat, causing cough. That's the pathway for that.
Yes. Okay, so it's true then.
In a way, it's true. Not all, not everybody, but for some sensitive. To cold, it's of cough.
Okay.
Not everybody.
Not everybody. Okay. How about this general belief that when a child is coughing, they should not drink milk because milk will actually cause more mucus or production of mucus from the child's chest?
I'm not sure about that.
You're not sure about that? Okay.
I don't think there's any relationship between drinking milk and cough.
Okay.
Milk, a child drink milk, also breastfeeding is a sign of milk and it doesn't cause cough.
Okay. Okay.
So I don't think there is any relationship between milk and cough.
Okay. All right. Thank you so much, Dr. Akinola. I've been speaking with Dr. Akinola, Dr. Olufunmilola Akinola, a consultant pediatrician from St. Ives Family Hospital. We'll be talking about cough in children. You have the opportunity to call in. Please go ahead and call the number 07000 917 917. 07000 917 917. If you have questions regarding this particular topic, or you just have questions about your general health, it's a very rare opportunity to have a real doctor in the studio because they're always busy. So if you have questions, by all means, call in now on 07000 917 917, 07000 917 917, or 090-256-25455, 090-256-25455, or send a text or WhatsApp message to 070-317-56537. This is Radio Doctor.
Radio Doctor and WFM 91.7 every Monday from 10 to 11 a.m. brings you medical experts specialized in children's health.
Studies have shown that children that were abruptly stopped from breastfeeding tend to have some emotional trauma.
Call in to get free consultation on children's health on 07000 917 917 or 090 256 5. You can send in questions, cases, and related contributions on social media, Facebook, Twitter, and Instagram at WFM917. Text and WhatsApp on 070-317-56537. You can listen live online at www.wfm917.com. Radio Doctor, Nigeria's first free consultation radio health program on WFM 91.7, the voice of women.
Yes, indeed. You're listening to Radio Doctor on WFM 91.7, Nigeria's first radio station for women and their families. Radio Doctor is your free health consultation advice, real people. The real doctor has been Dr. Lufunola Akinola, a consultant pediatrician from St. Ives Family Hospital. Dr. Akinola.
Good morning.
Yes, Matt. Thank you so much for still being on. Just to wrap up real quickly, what would be your final statement on cough in children?
Cough, as simple as it is, may be dangerous if you don't treat as soon as. So if you have a child that is coughing 2-3 days, 4 days, and especially if it comes with other symptoms, fever, difficulty with breathing, please don't hesitate to take that child. May not be as simple as that. And at the same time, I would advise mothers to
Hello, doctor. You said you'd advise mothers, okay?
To immunize their children.
Immunization.
Immunization. That also prevents some diseases that that comes with cough.
Okay.
Influenza, they have flu vaccines.
Okay.
Then we also have diphtheria, take care of cough. So
okay.
It is important to vaccinate so as to prevent some of these childhood diseases.
Okay.
And also, as I mentioned earlier, avoid exposure of children to tobacco smoke. It wasn't cough.
Yes.
For those that have cough before, can also expose these children and make them to cough, especially asthmatic children.
Asthmatic children.
Avoid exposure to tobacco smoke.
Okay.
So all these ones, help us to take care of our children and keep them healthy.
Okay. Well, thank you so much, Doctor. It's been a pleasure, as always, to have you on the program. Thank you for all the valuable knowledge you shared with us this morning on the program.
Thank you.
Thank you so much. Thank you. And do have a great day. Thank you.
Thank you.
Thank you. And thank you for taking good care of our children. Thank you. All right, that has been Dr. Akionla, a consultant pediatrician from St. Ives Family Hospital, really giving us lots and lots and lots of very valuable, important knowledge on cough in children. So, if you're a parent, I'm sure you've learned a lot. When your child has a cough, don't just take it for granted. Think it's just a common cold. Yeah, just buy cough syrup. No, 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 no. Make sure that you go and see a doctor, a qualified medical professional, to properly diagnose your child, because what you think is just a common cough or a common cold might not just be that. There's so many reasons why a child might have a cough. On that note, thank you so much for being part of the program this morning. My name is Timmy Tokwe Olule. Remember, Read a Doctor is your free health consultation program where real doctors advise real people. Read a Doctor is Nigeria's first specialized radio health program on Women Radio, WFM 91.7, broadcast from 10 a.m. to 11 a.m., Mondays through Fridays. I want to say a big thank you to the producer of this program, Esther Alaribe. Thank you. And also definitely to Dr. Akionla for being on the program this morning. Do join us tomorrow morning from 10 a.m. to 11 a.m. for another episode of Radio Doctor, your free health consultation program. Please stay safe and have a nice day.